I'm Sian from Aurora, and I'd like to spend a couple of minutes talking to you about why many people in the pharmaceutical industry hate social media. And to be honest, you can understand why people might think that social media is a compliance minefield and prohibited by our regulations. If you take a look at our UK code, for example, there's very little guidance in there on the subject, and it all feels very prohibitive. On a European level, any communications with online audiences may be perceived as promotion to the public, so there are a number of concerns here. In addition, we know that we can't control the quality of information on other people's websites, even if it's about our own product. And what happens when people start having off-label discussions? How can we ever be sure that social media won't be perceived as solicitation? On first glance, it all seems rather doom and gloom. Social media plus pharma equals impossible. But actually, once you start to dig down and scratch the surface, what you'll find is that there are no hard and fast rules about how pharma can engage in social media. And what we really need to do is ask ourselves one key question. What are we actually trying to achieve with social media? If on the one hand our answer is increasing access to accurate, fair and balanced information on different health issues, then social media is a fantastic place to start. If on the other hand we're looking to promote or advertise specific medicines, then it's definitely the wrong place to be. Once we start to accept that social media is also all about dialogue, it's about transferring information, it's about communicating with people, then the rules of the game's change, and it doesn't actually look so gloomy as we first thought. And of course those rules of engagement will change depending on who you're talking to. You might be considering engaging with nurses, with doctors and pharmacists, or even patients, for example, and we just need to go back and ask ourselves that one key question. What are we actually trying to achieve with social media with this specific audience? If we can answer that question in an appropriate code-friendly way, then there's no reason why we can't start having those conversations today. So it's not all doom and gloom, and in fact there's lots of change on the horizon. The PMCPA is considering its own position on social media, and indeed the FDA are reviewing their own regulations. The information versus promotion argument is also being considered at a European level. So there's lots of change out there, other people are getting ready for change, and we need to be ready too. At Aurora, we understand how to develop code-appropriate processes that can support social media. Visit our blog or give us a call. There are also some other I Hate Social Media videos on our YouTube channel, so take a look.